Coming up, it's going to be your QEH Pulse radio show. And this is brought to you with the compliments of MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemets Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
And a pleasant good morning to everyone, all of our listeners in Q100.7 CBC Radio Land. This is another edition of the Pulse Radio Show, a really special edition, episode 12, but it is the finale of season 1 of the Pulse Radio Show. So don't you fear, well, this is the finale for the first season, and we'll be on a break for roughly 4 weeks. We'll be back with you on October 3rd, I think it is, the first Monday in October for season 2 of the Pulse Radio Show. I'm your host, Shane Seeley. Always alongside me is our Chief Operations Officer, Dr. Christine Greenidge. Good morning, Dr. Greenidge. How are you doing?
Good morning, Mr. Seeley. I'm doing well, and how are you today?
I'm okay. I know both of us had a very busy weekend. Of course, we had to send out some notices to the public, as we always do. We try to make sure that we bridge that gap of communication with you, not only through this show, but through the many notices that we send out. I always encourage our listeners to please go to our website for information, but also you can follow us on Instagram and Facebook, where we have a presence through our QEH Connect pages, so you can follow us there to see all of the updates and the activities. This is our 60th anniversary as well. We continue to celebrate that. We are getting very close to that special date, November 14th, so you can put that on your calendar and you will see a number of events coming up to that date, and a very special one, which I'm going to tell you was birthed right here on the Pulse Radio Show. You'll get a bit more details as we get into season 2. But as I did mention, we did send out a notice to the public this weekend relevant to what was happening in our accident and emergency department. Of course, that was an advisory, and it continues. We continue to share that information with the public. So what we would have sent out yesterday, the Accident and Emergency Department continues to respond to what has been an increase in the number of patients presenting for treatment with various medical complaints, and the increase is notable as the AED medical team works to manage this surge in attendance. We want to remind you, the public, about some other options for medical assessment and treatment to avoid any extended wait in the department, especially if your case is non-life-threatening. To assist you in this regard, you can call our Patient Advice and Liaison Service. It's better known as PALS, or our help desk, at 536-4800. You can also call normal, or you can use WhatsApp calls between 9 in the morning and 12 midnight. Our medical personnel will be there to give you an initial assessment and provide advice so that you can determine your next course of action for treatment. You can also call or seek treatment at the 24-hour polyclinic. That's the Winston Scott Polyclinic at Gemets Lane, St. Michael, which is a stone's throw away from the Queen Elizabeth Hospital. Or you can contact your private medical physician for advice on your condition. So this is a notice, an advisory that we would have sent out over the weekend. We continue to manage the situation in our accident and emergency department and respond to the urgent needs of our patients.
Yes, and that advisory and information was sent out over the weekend to ensure that the public is aware of the current, at that time, situation in the AED. And Shane, and also the public, and good morning to everyone. We send these out so that there is real-time information present to the public in terms of utilizing emergency services, and also highlighting the various options that are available to everyone. And I'm glad that this morning, Monday morning, that we are beginning to see some patients moving out into beds. We had what we call a little bed crunch, meaning that we had more patients waiting for beds in the inpatient setting than we had beds available. So our team came together, various disciplines, to look at the situation, not only from the point of the AED, but also the inpatient status. And this morning, we are facilitating inpatient discharges to free up those acute care beds and to move some patients out of the AED.
Indeed. So, as the CEO said, we continue to work, and it's all to ensure that we meet the needs of our patients who need our help, especially those ones who come in. A lot of those category 2s, category 1s, they have to get urgent care.
Yes.
And it's always good to, help you to understand our triage system. There's a triage system in place, and it's something that we did from the start of this Pulse Radio show. We always try to break down what we are doing so that you can understand, you the patients in many cases, why you have to wait, why indeed that there is a waiting time. What we do in the department, we try to communicate with you. We try to ensure that you understand what we are doing, but when you come there, you're really at your lowest. You need that care, you need that empathy from us, but we must also communicate to ensure that you understand what your medical condition is and the course of action that is being taken. It is a course of action that will have to take time. So we ask you to try to rest and relax as much as possible and let our doctors and nurses make that assessment. That is something that we did. We had the first program, myself, Dr. Rhea Corbin Hart at the time, we really made an introduction about what we are doing as a part of this Pulse Radio show. And then we came into that critical department. That was episode 2, the accident and emergency. And you're probably wondering why you're hearing me talking about what happened all those weeks ago. That's because on this show, since it's our finale for season 1, we're doing a bit of a review. I must make an apology initially though. Our CEO, Neil Clark, he was supposed to be joining us on this show, but he was called to an urgent meeting. So he's going to try to snip in and be on the phone line to share a bit of his thoughts, but it's mainly going to be me and the crew, and we'll field your questions. Remember that you can call 4341007 or 4341070. You can also WhatsApp us at 4341007. I think we have a caller on the phone lines. Welcome to the program, the Pulse Radio Show, our season finale. What's your question or comment? You're on here.
Good morning.
Good morning.
Good morning, Shane.
Good morning. How you doing?
I'm in mourning. I lost my brother and my cousin on the 19th in B7, and my cousin in C10 on last Friday would have been what date, no? Friday gone is what date?
Friday gone, that would have been August 30th.
30th, yeah. I lost my brother on the 19th in B7, and then my cousin in C10 on the 30th.
Our condolences to you and your family.
Shane, I must commend you for doing a good job at the waterworks before you came over to the hospital.
Thank you very much. I smile and laugh because I still, do Water Wednesdays, and I'm still a part of that. The Barbados Water Authority is
right,
like family.
Right.
And it's so good that actually the Barbados Water Authority and the QEH work so closely together.
Right. But I didn't know that y'all were so compatible.
You know what? every institution needs water. Every
That's
Barbadian
right,
needs
right,
running
right.
water, and I know the Barbados Water Authority has been working through.
Well, let me just interject. 'Cause I
Let
know
me
we don't have
cut.
much
Yeah,
time. Let me
no
interject.
problem. Go
I
ahead.
want to make 2 points.
Go ahead.
Because, like I said, I know the Prime Minister did say that coming up from the Water Authority, there are 3,000 bad mains that need to be fixed. Now, we need a lot of money to get those 3,000 mains fixed
Mm-hmm.
so we can get a water to a lot of residents in the country.
Right.
And I must let you know that I'm a diehard BLP member. I'm a member of the Barbados Labour Party
Okay.
for almost more than 35 years.
Wow. Commitment.
But
That's
I
commitment.
want to ask, who's the doctor there this morning?
This is Dr. Christine Greenidge, our Chief
I wanna
Operations
ask Dr. Green
Officer.
a question.
Good morning, sir, and let me extend my condolences to you and your family
Yes,
on your
thank you,
recent
Dr.
loss.
Greenidge. Let me ask you. I've been on medication now from the psychiatric hospital for 21 years. I went to the psyche because I went through divorce for stress.
Okay.
Right. But I'm eating well, I'm sleeping well, I'm taking my medication. But is there anything that you would recommend to supplement the medication in terms of what, just taking the medication or anything like, what the word I'm looking for? Oh Lord Jesus, oh Lord. Some form of medicine, something to supplement, you can take to supplement the medication?
Well, first of all, your provider, your physician, and you together will plan and ensure that you're following the regulations and the administration of your medications.
Right,
but because you're taking medications for your mental health, there are other physical activities that you can engage in once you don't have those physical limitations to help you in terms of, you mentioned stress, so in terms of relieving your stress.
It's a long time now, 'cause I don't have the stress anymore.
Oh, okay, all right. But if you're physically able, a lot of physical activity will
Yeah, I'm an evangelist.
You're evangelist. Okay, so you have your religion in terms of your beliefs and your sources of support from your your members maybe in your church as well. But long walks, sometimes just take it in nature, maybe walking by the seaside or places where you can really
I was supposed to get a bath on Saturday, but I didn't get there.
Oh, okay. So you already have that as part of your strategy. Sometimes.
But you think that they would take me off the medication at some point in time?
I can't really make that assessment. That's really your private doctor is the best person to consult with you. Okay? So stay well.
Okay, you stay
Take care.
Thank you, Shane, Kimberly, and Dr. Greenidge for your sympathy and your praise. And the funeral is and most likely will be on Tuesday the 10th. So if you can make the effort at St. George Parish Church 3:30 on the 10th, we will be glad to see the doctors or representatives from the hospital. Okay.
Okay. You take care.
God bless. Bye-bye.
Yes, thank you for calling and sharing with us here on the Pulse Radio Show. Again, a reminder, those numbers to call, 434-1007, 434-1070, and you can also WhatsApp the first number, 434-1007. So before the caller came on air, we were speaking about all the things that we do as far as communication is concerned, as relating to accident and emergency. Since I came into the role of communications specialist at the QEH, looking from the outside in and knowing some of the challenges that I would have heard about on the outside, it's a whole different view when you actually come into the organization. So a big thing for me was trying to help Barbadians to better understand the flow from A&E through the hospital. We have spent a lot of time on this. I remember people were very resistant when they were getting those initial communications about patient surges, about ebbs and flows. The accident and emergency department responds to whatever comes to it.
Absolutely, and we don't have the choice not to see someone. And that's where fundamentally the whole accident and emergency services is really rooted in. We see everyone that comes through the door. we put everyone through the triaging process that we have spent several times here on this show to educate the public. And it all has to do, to put it very simply, it all has to do with the priority of the clinical signs and symptoms that we see someone presenting at the door in the emergency room. And those clinical symptoms are assessed in terms of priority, and then they are assigned what we call a category of assessment, categories 1 through 5, and of course categories 1 and 2 being the utmost life-threatening presentations.
Indeed. And we talk about the A&E now. That was on episode 2. But more recently, we have heard our Prime Minister, Mia Amor-Motley, chime in about some improvements coming for the hospital as far as staffing is concerned. And she did point out the AED. Of course, she would have made these comments on Saturday at a branch meeting of the Barbados Labour Party, speaking about some of those things that are coming for the hospital. And we'll play that excerpt for you in a matter of moments. But that was episode 2, where we really drill down into what is happening in our accident and emergency department, and we came back to it again because we thought that, with the calls that we've been getting, and really and truly we must thank you callers for your input, because your input has helped to shape what we do on the Pulse radio show. But coming to those comments from the Prime Minister, she would have spoken over the weekend to her audience, explaining what is happening at our hospital. Is something that we ourselves have been working on, being ready to facilitate the new staffing levels coming to AED and really across the hospital. Here's what she had to say. Take a listen.
We are introducing patient safety officers, and we're introducing a new service improvement manager, because we're not fooling anybody. We know that there must be improvement in service delivery at the hospital. We know that we are short on nurses. And in fact, Cabinet agreed on Thursday that a team of 6 will go to Ghana yet again to be able to allow us to bring in 112 nurses from there. But I have agreed also to create in the nursing department 142 registered nurses alone, 71 this year and 71 next year. In addition to that, we have committed to being able to create something called a nurse practitioner and to equally have clinical nurse specialists. We accept that the A&E department needs continual beefing up. And therefore, we have agreed equally that between additional nursing assistants, nurses, departmental aides, general workers, orderlies, across the whole spectrum, that we and 2 consultants and 4 senior registrars or house officers, in other words, 6 doctors altogether.
That is our Prime Minister, Mia Amor-Motley, speaking about those enhancements as far as staffing levels are concerned to, as she says, beef up the accident and emergency department, but also geared to help the wider hospital in terms of responding to your needs, the public and our patients there.
Absolutely. Our Prime Minister has been listening to a lot of what we have to say at the facility. But most importantly, I am a registered nurse. I am a nurse, and I appreciate her ears in listening to how nursing practice can be enhanced, but most importantly, how we can help our nurses to be more autonomous in meeting the needs of the public. And it is no secret that we are, like many countries around the world, we are in a crisis in terms of nurses being available. This is a worldwide phenomenon. It's not limited here to Barbados. It is in the United States. It is in Canada. It's all over. And globally, there's a very competitive market for registered nurses. So her efforts in working with us, in working with the Nurses Association to recruit some nurses from Ghana will be a big, tremendous help in terms of our ability to staff safely throughout the facility.
Indeed.
And let me just mention, she mentioned a nurse practitioner. She mentioned also clinical nurse specialists, and these are advanced levels of nursing practice. But primarily, the nurse practitioner is a role that we really need to engage as quickly as we can get our nurses trained. What they can do is that they can prescribe, right? They can prescribe, they can assess, they can diagnose, and they work hand in hand with a physician to take on a case load of patients, many times by specialties, but they come as family nurse practitioners, as geriatric nurse practitioners, and you know that our population is Asian. We are on the upper end of age here, so we look forward to these specialties. Clinical nurse specialists are known to practice based on a disease entity. For example, you can have a CNS, a clinical nurse specialist, who is profoundly certified in diabetes, right, to work with that patient population. But the assistance of these advanced nurse practitioners and CNSs will help our physicians, but help our patients more intimately, and so really focus on preventative, what they can do to keep themselves much more healthier, and also disease management. So I have diabetes. How do I live my best life with this disease? And this is where it's going to make a great difference. And I really applaud. I've been to several meetings with the PM, and she's asked questions, and I've provided the best answers I know from a nursing clinical point of view. Two other things that she said that really totally love the idea. I happen to be one. I'm a patient safety officer. I was trained by the IHI, and that role is so fundamentally important in healthcare, especially in our hospitals, especially as part of our quality management. The patient safety officer have eyes, hands, ears, everything around the safety of patients from every angle, whether it is how long a patient is waiting, whether it is compliant in terms of practices, or patients following the medical plan of care. So the patient safety officer is a new role. I'm really looking forward to that individual being trained formally in the role and then making a difference in patient outcomes.
Indeed. We have another caller here on the Pulse Radio Show. You're on air. What's your question or comment?
Good morning, Shane.
Good morning.
Yes, I did not pick up a lady's name.
Dr. Greenidge. Dr. Christine Greenidge.
Yes.
She is our Chief Operations Officer.
I have a few advice. I spent 17 years in that institution, QEH, and I always say to persons that there are two government departments that I love to my heart despite so many things. That was the first place I worked was the prison, and then the QEH. And I find that the service, despite what people may say, when I look at the other countries in the Caribbean, nobody can touch us. It's good. It is just that sometimes people cannot separate speaking about political and they lump everything to make the institution look. So sometimes I go in there to prove sometimes what I'm hearing if it's really true. Yes, we do know there might be a little problem, not sometimes with the nurses, but sometimes people complain about records department, people not taking the calls and stuff like that. But what I would say is that when the hospital changed from casualty to the accident and emergency, I thought at least it would work for people. What is saying that is for accident and emergencies. But we still have people that see as a polyclinic or a normal general practitioner come in the stomach feeling good, they got a stump toe.
Yes.
And that puts pressure when you have those cases added. Now the whole thing, if you have persons are gunshots, stabbing, you have persons with asthma, those take priority. And therefore you might say, boy, was here last day and this boy no come in. No, it is accident and emergency.
Yes.
And I'm saying that it was, when I was going to school, it was always that people condemn. It was casualty and then now into the department, which I'm saying if we could have people understand it, and I think y'all keep on saying the purpose, the functions that you have to work with first. And you may have come in at night, but your case cannot be compared to that critical area where you have to deal with that patient based on what the department was set up for.
Caller, let me just, first I want to thank you for the many years of service to the Queen Elizabeth Hospital, and secondly to say that you are so on target, on point in terms of your perception. And I never gave it a thought, but you have just noodled in my head of the name of casualty to emergency and probably not redefining exactly what an emergency is. But you really mentioned several very valid points. And what you described at the beginning of the call is when someone thinks that an emergency room is what a place where polyclinic, for example, and or what we call the point of care where should be primary care. It is not. It is for exactly what you describe, a dire emergency. I like to say life-threatening. You mentioned the gunshot wounds. You mentioned asthma. You mentioned heart attack. Those are the priority levels of care presenting at the door that we must right away go into what we call, it could be trauma as well, but go into a mode that we say that these are the priority levels, usually categories 1 and 2 of service. And yes, I think that some of the public perceives that I came in at 10 o'clock and this person I came in at 10 o'clock and this person came in at 2 p.m. and right away they're being seen. It has to do to the level of the presentation of the severity of what that clinical symptom is. So thank you so much, and once again, I thank you for the years.
That's one last point. Before, when we came from, the government at the time brought in an expert from America, and he was the person who created and all of the different areas within accident and emergency he would have created. We had sessions. The whole of Barbados knew what was the purpose. You had GIS at the time. It just surprised me that this is a younger generation which should be a little more educated, and you knew exactly what was the purpose of it. Yet still, when an emergency comes in, people are still making noise, and that is the thing. What we need to do is if it's possible, if that the nursing part that could come up sometimes, like how you will see different areas, like you will find sometimes banks come out in the square and they tell people about their mortgages and stuff like that. If it is possible that we could get some of the senior nurses and yourself to come out and sensitize person, I think sometimes these things do work.
Yes,
do
I
work
agree with that.
to make them understand that you are not dealing with the polyclinic nor the general practitioner. You are dealing with life and death. And when somebody dies, they are the same persons will say negligence again with QEH. They got the shares with the undertakers. Those are the things I hear on the buses. Yeah. And I would like, if they could come out sometimes. November coming up, which will be the anniversary of QEH, and I would like to see more persons. And I'm now about to start my master's in international public health management, which would be cover all of these areas, so I can make because I retire, but I would like to come in and give some input and help the younger persons who work in that institution, how that they can stand up for the department, and when people make these comments to correct them. Because if they work there, they don't correct them, then the public then would go on with that. So thanks so much for entertaining me.
And thank you. And
You're
really,
welcome.
I'm going to capitalize on your idea. Shane is here from communications. I think it's great what you're saying. And you know what? We save a lot more lives. We treat a lot more people and have good outcomes for many, many people over the last 60 years of service. So thank you so much for your thoughts.
Indeed. I agree with the caller.
Yes.
She mentioned outreach.
Yes.
And there's something coming, a big outreach plan. I don't want to let too much of those cats out of the bag. So you can listen out for that. We'll definitely promote it and share it so that you can be a part of it. And it's all wrapped up in our 60th anniversary celebration. So listen out for more on that. Currently, you're listening to the Pulse Radio Show on Q100.7 FM, a production of the Queen Elizabeth Hospital. We'll take a break and be right back.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
You're back with us as we're halfway in what is our finale for season 1 on the Pulse Radio Show. I'm Shane Seeley. With me is Dr. Christine Greenidge, our Chief Operations Officer. And for that last caller, if you can, please call back. We want to get your contact to see if we can get some more information from you and learn from your experience. It's all about sharing your thoughts so that we can better respond to the needs of our patients and our staff as well.
Yes.
Because she didn't mention learning experiences. That's a part of life, and our staff can benefit from some of what you would have just mentioned. And speaking about that, we were speaking about the Prime Minister's comments, and I know you doubled down on the nurse practitioner and how much of a game changer that could be for the hospital in expediting some of our services.
Yeah, they can definitely work two very important areas, I think, in the hospital. One is the outpatient clinics, definitely. And certainly they can also work within the emergency room. They can see the lower levels, categories, those, for example, categories 4 and 5, where they can see and treat, and under the jurisdiction and also the support of our medical doctors. But there's some things that need to be done within the country, and that is a broader definition of the scope of practice of who this nurse practitioner will be, and in terms of identifying clearly the realms or the borders of the practice. Yes.
Yes, indeed.
So they can write your prescriptions.
They can.
Yes. They can also write your medical plan of care, your regimen, and many times in consultation with the physician. The nurse practitioners have been around, especially in the states where I'm from for decades, and have made a difference in terms of primary care even for patients, and helping those that have disease states live much healthier lives. So there's an integral and crucial role that they play.
And they will be playing that role very soon at the Queen Elizabeth Hospital, so you can look out for that as one of the enhancements to our services offered there. Speaking about services generally offered at the QEH, and we went in a lot about this on episode 3 as well. It was a highlight because we focused on hearing your concerns and having you share your thoughts through our clinical risk management unit. And I will share those numbers with you again because we want you to do that so that we can learn from your experience and enhance our services. But also, as a part of our services, we have been doing some great work in terms of transplant. We had 2 successful kidney transplants at our hospital.
And that was done in the month of July, and I am a little saddened that we didn't really play that up. That is a tremendous improvement in terms of kidney transplant. And when you compare that in the month of July, we did 2. Last year we only did 1. And this has to be a common feature, because I really believe that the public needs to be more sensitized but educated in terms of what the ability to have a new kidney for someone who is what we describe to be chronic kidney disease, often brought about many times related to go back to diabetes, but how family members, how friends, how the general public can help another person live a normal, healthy, or better improved life. But the important thing with kidney transplant is that a healthy adult can live a normal life with 1 kidney. And I have to be honest, right now we're looking at the trajectory of kidney disease in the country, and unfortunately it's going up, which means that right now the majority of our patients are treated for that by dialysis. We can reduce dialysis treatments if we have someone who is fitted, who can donate a kidney transplant, a wonderful transplant team. And this is something that I want Barbados public to be aware of.
And we are going to do
right?
the education.
But not only that, it's also the getting to policy changes within the country in terms of making decisions around donation of kidneys. We have unfortunately, we have a very young population that we're losing to violence, right? To gunshot, to stabbings. And these are relatively healthy people that have many different organs that we can be transplanted and keeping others healthy and better. So, and that's coming. I know that our transplant team, have been integral in contributing to policies where that can make a difference. But yes, we need to do a feature on our transplant team and the benefits of, in particular right now, kidney transplants.
I know the Minister of Health, the most honorable Dr. Jerome Walcott, has been working on that legislation for the donation of organs from cadavers.
Yes.
It is something
living
that can
donors.
Living donors as well.
You have living donors, and then you have what we call cadaver donors as well, and those are people recently deceased. But that young population I just mentioned that we're losing, unfortunately, to violence and sudden deaths, motorcycle accidents, car accidents, gunshots. These are relatively young, healthy, with organs that are probably 100% that can be transferred upon death to other people in need. A big need, cornea transplants, kidney. But Minister of Health, Dr. Walker, has been integral in getting this done. He's also working on so many different procedures and protocols, working intimately with us as a physician himself, but really supportive in this idea.
We have to salute Dr. Margaret O'Shea. She was a part of the program. She's a consultant transplant surgeon at the QEH. She would have led the team, and we also have to thank the visiting team from the UK, the charity, who came in to help really guide the process. We must salute them, Transplant Links, for supporting us in that regard. They want to help us develop that whole idea of, and I know some people may be uncomfortable. They may sit down at home and think about donating a kidney. This is a part of me. What will happen to me? And that's why the education right here on the Pulse Radio Show is so important.
And this is why I emphasize that you can have a normal, healthy adult can lead a normal lifespan and live comfortably and healthily with one kidney. But in the meantime, saving the life a kidney transplant changes the whole approach of living. Instead of having to have 3 days a week of what we call dialysis, hemodialysis treatments, or some at home, they have home dialysis as well. That's peritoneal, that's dialysis through the abdomen. And it makes a complete lifestyle shift. And I want the Barbadian public to be more engaged in the conversation, but understanding. A big part of the show, Shane, as you know, when I conceived the idea, had to do with public education. The more we educate people, is the better understanding, and understanding their own body, how it works, what they can do to keep themselves healthy is so important. And this is why the Pulse is all about. And so we really want to sensitize the Barbadian public more about the benefits of kidney transplants.
Yeah, it's always, as you said, conceptualizing that name, the Pulse.
Yes.
It has been about getting and understanding the pulse of the people, helping people to understand the pulse of the QEH and how we operate to serve you. We spent 11 episodes doing that education, talking about the way forward, even when we had the CEO on the program, sharing his thoughts and his vision with the new health information system coming that would help people to have some more control over their health outcomes, over the access to their care.
Yes, Shane, I have this philosophy, and I believe that people must take charge of their health states.
Hold that thought, COO. We have a caller Welcome to the Pulse Radio Show, caller. What's your question or comment? You are on air.
Yes, hi, great morning, Shane. How are you doing?
This couldn't be a show without you. I'm telling you.
Good morning.
You took long to get in here.
Fantastic. Thank you so much. Well, this has been one of my great shows that I listen to. I know that this has really filled a void in terms of our health, in terms of the wonderful health information, dissemination of information of people to this country in terms of our wonderful hospital. I really want to thank you for these 12 episodes, and you did a fantastic job. When I go online and I like on the YouTube and I listen and I comment, it is so fantastic. And I let my family listen, I let people listen who hear, who love it, and they really appreciate our contributions and my comments as well as my questions. So I thank you so much. Good morning, Dr. Greenwich. How are you,
Good
ma'am?
morning. How are you today?
Yes, my favorite manager, person there at the hospital, my favorite. Yes, ma'am, it's great to hear you. Well, I'm going to miss you for these next couple of weeks, but I know that we're going to have a wonderful reunion.
Absolutely.
Fantastic. Well, I'm all about money this morning, Dr. Greenwich.
Yes.
I know that you mentioned the transplant. I know that it's important to know that I hope that we could have some legislation as well that the hospital can facilitate. Or since we have such a public who live long and who are so strong in health, I know that we're the three of the world that are the greatest in terms of the Okinawa people, the Loma Linda people there in California, those people who live very long, to have the most centenarians. I know that we have the most centenarians as well, and I think that we should really have more people giving transplants to their bodies via legislation at their death, and as you mentioned, in their life, so that we can sell to overseas, we can sell to whoever else in the world who wants it, who also has aging populations, but may not be as strong as us, who we are the capital basically of the world, hopefully, I would want for transplantation in terms of selling our kidneys when we go to America, to Europe, to Asia, those people who need it, because we have the more centenarians and we live the longest and we're the strongest and we have the best diet. You see, we have the best food in the world, and we have a real work ethic in this country, and we have a health ethic thanks to our hospital, that we're immunized, that we're vaccinated, and that we have great nurses and doctors who care for us and who keep us healthy. And as we've been able just to negotiate the crisis, I just wanted to ask as well about the pooch virus for the mosquito. I'll give you an idea. You should do know that this is the season for mosquitoes. There is the Zika. There is the dengue. There is chikungunya. Those diseases, you should do an episode on that as well in the coming season.
Yes, we definitely will. We definitely will.
Thank you.
Finally,
okay. My
my
final point. Just on the before I go, just on the organization, just on the sponsorship. A person or organization that pays our plans and carries out a project or activity, and I believe that every time something like this is done for the hospital, that their media department, the communication specialist, you, Mrs. Seeley, should seek sponsorship for whatever y'all are doing in terms of getting that wonderful health information out there to the people. A lot of people don't know, a lot of people are just ignorant, and a lot of people need that when you're able to have one person paying the cost, especially for the radio or television programming or whatever media. If you're holding a seminar at night, that you should have it sponsored. Make sure that it's sponsored, and make sure that people even can sponsor award when they receive good service. Because I'm all about money this morning, you see. If you receive good service, you should be able to sponsor award at the hospital so that they invest in your pharmacy name, in your nursing, in your whatever medical facility that you own's name. So that if I own Kamal's medical facility and I get good sponsorship on B9 where I receive fantastic service from the nurses and the doctors and I felt good, let me give you $3,000 so that you can put my name on the show in the new season. So that I'm able then to get my name up there, Command Medical Care, in terms of the theme and the role of sponsorship is important. And you can gain a lot of money from it. So I want to thank you. Have a blessed day. Bye-bye.
Yeah, thank you. Yeah, and
Great
thanks
ideas.
for the reminder for sure, because this program has been sponsored by MedSafe Medical Supplies Limited. They're a provider of a number of services, and it's good that corporate Barbados can sign on to initiatives like these, which really seek to serve the public, which really seek to give information to the public, not only for their personal responsibility as far as their health is concerned, but help to direct them, help to put them in the right direction.
And corporate Barbados employ people. So part of the vested interest is that to keep your staff, your employees healthy. And I think that our caller made some great ideas. In terms of the selling part of organs, we don't want to discuss that. That has a lot to do with legislation and ethics and other things other than that. But thank you so much. I appreciate there were a couple of points, Shane, that I thought he made that we really seek to investigate and discuss.
Yeah, for sure. And that is what we like. This interaction has really helped us, and I'm talking about this interaction on the Pulse Radio Show, has helped us to really shape what direction the organization will go in.
Yes, and I think, we are in our 60th year, and just piggybacking on his idea that, giving back, corporate, even personally, is something that benefits. We have a great philanthropy officer, as you know, Ms. Howell. And if there anyone out there that's interested in doing that, maybe recognizing us for 60 years, we've done this public very, very, very well for those 60 years, despite many challenges. Our facility is Asian, and our team at QH, and we do our best every day to ensure that our services are there and our equipment is working, as we had Ms. Paula on a couple of weeks ago, that we keep these equipment functional for our public.
We have to. And the engineering team, the Department of Engineering Services, they work around the clock to make sure that those 19,000 plus pieces of equipment that are there are in working order. I always say we're humans. We don't always get it right.
We're not.
But our mantra at the hospital is we learn from our experiences, we learn from where we go wrong so we can correct it.
I'm going to put it globally. Healthcare business, it does not always get it right. And the struggles that we have here are not are common throughout the world in healthcare. Technology changes, services changes, resources changes, and yet we are still provide the best service that we can to keep people healthy. To fix the many challenges that we face. You come in A&E, a couple of gunshots, and majority leave taken care of, right, and back in society. So there's a whole lot, and we strive, though. This is why the public voice is very important. It keeps us challenged in terms of always in a continuous mode of checking our quality and our outcomes. And it's the public's honest voice that we want to hear and keep us on our feet in terms of the delivery and the quality of the health services that we render.
Yes, and a part of those health services are patient advice and liaison service. I will repeat this number all the time because I always say if you're in doubt, you can call and listen to a medical physician share their experience to help you better make a decision about how you need to respond to your current health status, to your health outcome. That number 536-4800, the Patient Advice and Liaison Service. They have been fielding a lot more calls, responding to a lot more calls. But what I'm also hearing via email as well, but patients have been getting through and they have been directed to where they need to go, whether it be accident and emergency, whether it be the clinic, or even to see the private medical physician.
It's navigating the system. And remember, a hospital is a big place, very unknown to many people. And therefore, we have to make sure that people know how to access and navigate the system. Those two things are very important to Mr. Joe Public, right? How do I get where I need to go? Am I here for the right thing? But before even coming in, how am I able to describe the problem that I have?
Yeah.
In simple terms. Because we in healthcare, we have our own language. I can speak medical terminology that, Shane, you may not understand.
Yeah.
And therefore, we have to come down to where our public is and understand that simple language is so important to help someone get through the system.
That's a part of communication.
So, you
and
know,
bridging
so
the
there's
gap.
some age, we mentioned the age of the population.
Yeah.
For some older people, I have sugar. But you and I may say, you have diabetes.
Yes.
But we got to understand that the same two things be the same thing.
Yeah.
But make sure that the person understands
Translation.
what that's all about.
Translation. Yeah.
Medicine has its own language. And we have, as providers, we have to be careful we don't speak that foreign language to our people.
Indeed. We have another caller. Welcome to the Pulse Radio Show. You're on air.
Shane,
Hi.
good morning. Have you given thought that every person does not listen to CBC?
Yes.
That the other radio station, because I know that people who don't listen to CBC, and they got their own 98.1 or
So
whatever.
hold tight, caller. What you can do first is, please turn off the radio so that you don't get that feedback. That's okay.
Sorry.
Yeah. That's okay.
Sorry, but
You got it?
yeah, I move away. Yeah.
All right. So and second thing, you're very right, and that's why. And I'm still hearing myself, but
Yeah.
I'll try to let that not distract me.
Yeah.
We have a podcast on our website.
Yeah.
So you can go and listen back to every episode of this Pulse Radio Show.
Yes.
Every single episode.
Yeah.
That website is www.qehconnect.com. And you have all of those episodes where you can listen to in your own time. So you can get the information that you need at your fingertips.
And tell
Available
others about
to you.
the show.
And tell others about the show.
Absolutely.
So that then they will listen live to those that don't listen live will come and listen live to us.
Yes.
But that's the challenge that I'm faced with, because I know that there's some persons.
Everybody has their preference, and we understand that.
Yeah.
Yeah.
And
But we
that-
choose
that-
to be here on
Yeah.
Q100.7 FM.
Yeah.
And we choose to educate and tell the public about our services
and
and to
I-
hear from the public.
Yeah. I've been
And
hearing
soon,
this 'cause-
we're working on being on television as well for the next season.
Yeah.
So you'll have many options.
Right, so that those persons who are not interested in listening to CBC for one reason or that, because some persons 94
Got you.
from 124.7 is 100.7, the next is 98.1 or whatever,
We got you.
and they don't subscribe. You will hear this? No, I hear that.
Understood. Understood. You have another comment or question? Okay.
For the hospital a lot, I spent some good times there a number of years ago, and that's my first option any place, anytime.
We're glad to
Thank
hear
you.
that that measure of support for the work that our team does at the Queen Elizabeth Hospital.
Yes. Going back to public education, Shane, when I think about the types of cases of people coming through the accident and the emergency department, typically we see public folks on blood pressure medications, right? Maybe heart medications, very important, diabetic medications, and oftentimes, unfortunately, presented with signs and symptoms of elevation in those categories of illnesses, primarily because they're not sticking, or what we say, adhering to the medication protocol. Some of these meds have side effects, but think about life in terms of why your physician will prescribe such medications and take your medications as prescribed.
Okay, I think we have another caller on the line. Welcome to the Pulse Radio Show, the final edition for this season. We'll be back in October. What's your question or comment, caller? You're on air.
Peace be unto each and every one. I'm very sad that it will be back in October. I am calling to say thanks to the QEH. I know it's not. It is. You know, it's, I can say people complain of the services, and I'm just hoping that the services will get better. I'm just hoping for the best. What I would like to see is those persons who suffering with who suffering with cancer and those different diseases and cannot pay for the certain tests done. Sometimes people have to wait a whole year or maybe even more. Some die and gone and never get the test. I would like to see that speed up. That is what I would like to see. But for me, I can say thank you. I want to say thanks to Orange Polyclinic, Dr. Ward. He's the first person who diagnosed me almost with cancer, and then I was referred to the hospital, and I want to thank Dr. Bernstein and his team, Dr. Doyle, Dr. Thorpe, Dr. Gill, Dr. St. John. Those persons who look after me. If not, probably I'd be gone already or preparing myself for death. So in every bit of sweet, there's some sweet, and I want to thank those people. But I hope that you all will try and make sure, especially cancer, those persons who diagnosed with cancer and need to get certain tests done and cannot afford it, please don't let them have to wait so long, because it is sad when a doctor tell you're diagnosed with cancer and you have to wait them months before you could get a test done if you don't have the money to do it. And you don't sleep. It's a living nightmare.
Caller, we hear you.
I would like to see.
Yeah, caller, we hear you. And the new linear accelerator, which will significantly advance our response to cancer patients and treatment of cancer generally in our oncology department, that will be here by year end.
Yes.
We expect to have it operational so that we can treat more patients here on island. Currently, we are paying through our medical aid scheme for patients to be treated overseas. And I know you would have seen some numbers recently about those who would have gone over to Colombia for treatment.
Yes. I first of all, caller, I'm glad that you're doing well. Stay healthy. Make sure that you are in tune with any changes in your body and report them immediately to your doctor. Stay well. You bring up the topic of cancer, and for the most general public, when people hear that word, it presents a panic.
Yes.
It goes from not hearing it to death in 1 second. That's how cancer is perceived. And as a healthcare provider, we have to do a better job at understanding that a lot of people can live normal, healthy lives with cancer to the end. Cancer diagnosis is fundamentally important. And so when I talk about being in tune with your body, seeing changes in your body, but reporting them immediately to your physician. The most common cancers here in Barbados has to do with, in women, is breast cancer, in men is prostate cancer. And there are distinct changes, and there are preventative screenings available so that when we see a woman coming with breast cancer, that is not diagnosed at what we say stage 3 or 4.
Yeah.
Right, because we've missed 3 stages within. So I know that we're near the end of the show, but being in tune with the body, getting those pre-screening. Men, PSA is just a blood test. There's something called a digital exam. It's uncomfortable, but your urologist or whether male or female conduct these tests. It's the easiest 2 things for a man to be screened in terms of identifying potential prostate cancer. Women, it is this doesn't cost anything to be able to do a breast self-assessment. And there are techniques available out there that are free to instruct women in how to conduct a breast self-exam where the lump or that difference in terms of the texture of the breast is felt by yourself.
Indeed.
And secondly, the screening of a mammogram.
Yeah, time flies so fast here on the Pulse Radio Show.
I can't believe the hour is over.
Yeah, we have been doing this week after week from when we started some 11, 12 weeks ago till now. We really want to thank you listeners for spending time with us here on the Pulse Radio Show. We thank you for your questions. Even though this is the finale for season 1, we'll be back in season 2, and we're also exploring the possibility of going television as well. So stay tuned for that. We'll also be launching some of our testimonials from patients who would have received amazing service at the Queen Elizabeth Hospital. You can look out for all of these things wrapped up in our 60th anniversary celebrations. November 14th is the date, but you'll hear about a slew of events coming up to that date. We will keep you informed on our website, www.qehconnect.com. You can find all the updates there, and remember, you can call our clinical risk department to make your concerns and complaints heard. Those numbers can be found on our website as well. Thank you, COO. It has been a good ride for these 12 weeks.
Thank you, CBC.
Yeah, thanks. A big thanks to CBC.
Yes.
For being a part of this journey for the first part. We'll take a break, but we'll see you in October. Until then, I'm Shane Seeley signing off for what has been a great edition.
Call CBC with ideas.
Yeah, and please call CBC with ideas for topics for the new season, as well as the COO just mentioned. You can share them with Kimberly on their radio shows, of course, and Andre as they do their thing on air. But thank you for being with us. I'm Shane Seeley signing off
Shane.
For the Pulse Radio Show. You have a good day.
The Pulse Radio Show brought to you with the compliments of MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.